I'm an agency nurse and I work in different trusts across Kent. And me and my colleagues, we've all experienced such a traumatic year. The NHS is overrun because there is lack of staffing. They haven't invested money in paying nurses better. They haven't invested money in training nurses. The course is no longer free. It's actually, we have to pay for it. So there's no incentive for general public to actually want to train as nurses. So dealing with COVID, with lack of staffing, I mean, last week on my last shift, the ITU senior sister I was talking to in A&E came to pick up a patient to go on a ventilator in ITU and was telling me how they have funding for 24-bedded ITU, but only 16 nurses.
So there is capacity, but there is not staff. I mean, seems to be the story.
And people are traumatized. Nurses are scared to come to work because if you do have to work with a COVID patient, you're putting yourself at risk. And then you have the case of, we have the normal illnesses that are being left untreated. We have patients who are coming into hospital with long-term illnesses because they haven't received any care in the community and they're having to come into hospital to get treatment.
It was very important. So, I think I saw a tweet from Number 10 that said they were very pleased that sort of 14,000 nurses had just joined the profession. But they haven't given the nurses back the grant, have they, that made it...
14,000 is a drop in the ocean compared to the lack of staffing we've had for the past 20 years.
I hear you. Have you nursed to recovery COVID patients yourself, Shola?
Yes, I'm working with them even tonight. I'm working 4 nights a week, even more than I should be doing.
And are you is the lack of is the shortage of staff putting you at risk and your colleagues at risk?
Yes, because instead of working in isolation with a COVID patient for 4 hours, I'm having to do it for 8 hours, for more than that, because there's nobody to swap or exchange with me.
And do you feel that you have enough protection for your own safety?
Well, now we kind of do, but it's not up to standard. I mean, the stuff they're getting in from China is just shambles.
And are you getting tested so that you don't,
No,
that you're not?
I haven't had a COVID test since March.
What?
Yes, that's true. So when I work with immune-suppressed patients, cancer patients that come into A&E, that come into the ward, I have to be careful. I have to gown up. I have to make sure my mask is on right so that I don't infect them in any way. So that's the reality of things.
Hold on. So you're telling me that the health professionals in COVID wards are not being tested?
No. When was this even a fact? None of us are getting routinely tested. Nobody in the NHS is getting routinely tested, except for surgeons and those who are actively working in ITU and surgical patients that are having surgery.
But you do come into contact with COVID patients, don't you? I mean, you must nurse them.
Every day I go to work.
Right, I don't understand why that is, because obviously in care homes, the social care workers are being regularly routinely tested.
Yeah, because they're being funded privately.
My jaw is dropping, Shola. Do you know if this is standard practice across the NHS trusts?
Yes, I have colleagues that work in London. I have colleagues that work up north, and nobody's getting tested. Because if we got tested, and let's say you only have 16 members of staff,
you'd have to go home.
Yeah, you have to go home. So how are they gonna staff the ward when there's only 8 members of staff available and a ward full of patients?
I hear you. Well, thank you very much for your call. Surprising to me that you don't test frontline staff who are nursing NHS COVID patients on NHS hospitals.